From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's staff story is the Secours Center for Ministry Leadership. What is the Secours Center for Ministry Leadership? Well, simply stated, the Center for Ministry Leadership provides programs and processes for BSHSI leaders and co-workers through community building and relationship development that empowers competent and confident ministry leaders and co-workers in our communities. For instance, during fiscal year 2015, the Center offered 48 formation experiences to 2,133 healthcare leaders, from frontline staff through programs like Ministry Footprints, to managers with programs like Leader Day, to senior and executive leaders with programs like Foundations of Catholic Healthcare Leadership, Legacy and Leadership, and the MLF Intensive. Additionally, specialized programs were developed for the BSHSI Board, employed physicians, physician leaders, physician practice groups, and administrative assistants working with local and system boards. Also in 2015, Secours identified 4 capabilities for all BSHSI co-workers: ministry leadership, community focus, performance excellence, and system focus, or One Secours. Interested in learning more about the Secours Center for Ministry Leadership? Go to www.centerforministryleadership.org. The Ministry Leadership Lens describes how we expect our leaders to have grown and deepened through participation in the Center's programs. So, whether you are a CEO or a receptionist, a physician or a clerk, a chaplain or a transport assistant, the expectation is that Secours people do 2 things: demonstrate love and care in all human-to-human interactions, especially with those who are most vulnerable, and interact with others with an attitude of service built on trust and the spirit and values of Secours. Secours believes these behaviors make the Secours ministry distinctive from all other forms of healthcare services. And when people see a Secours person in ministry, they will experience in body, mind, and spirit a legacy of nearly 200 years of being good help to those in need. In other news, one of the foundational aspects of being good help to those in need is understanding what the core values of Secours are and what they mean. Last week we went over the value compassion. This week we want to talk about respect. Secours feels that respect is our commitment to treat all people well. It is based on our belief that each person has equal dignity because each individual is made in the image and likeness of God. We promote self-respect and mutual respect and trust among all the members of the Secours team. Respect behavioral norms include: recognize and respond to a person's innate human dignity regardless of ability to function or position in the organization. Trust and support each other. Communicate and share ideas with each other. Seek input from others. Include people in decisions which affect them as appropriate. Foster an environment that empowers all employees. Acknowledge and celebrate employees' contributions to the organization. Recognize, encourage, and develop leadership at all levels. Recognize coworkers as persons, not just workers. Be courteous to patients, visitors, and one another. Recognize, accept, and celebrate our differences. That's respect, one of the 8 values of Secours. Finally, this week is Healthcare Risk Management Week, all week long. And as Secours celebrates Healthcare Risk Management Week, we want to take this opportunity to share this year's theme, Making a World of Difference. Together, healthcare risk managers are making a world of difference in healthcare settings across the continuum by identifying, assessing, prioritizing, planning, and managing risks of all patients, residents, employees, and others. And one of the recent risks to patients and residents is theft of patient identity. Patient records are a treasure trove of personal information contained in one central location. Listen to this. In January 2016, the Identity Theft Resource Center produced a report stating that healthcare-related identity theft accounted for 43% of all identity theft reported in the United States for 2013. That's more identity theft than banking, finance, the government, military, or education. And as a provider, you can help by contacting risk management whenever an individual is requesting care and provides you with identity information that differs significantly from the information in their medical record and they do not have appropriate proof of identity, or when reviewing the information in a patient or resident's medical records with the patient or resident, you or the patient or resident have questions or concerns about the information in that record. In other words, something is not quite right in the records. Again, contact risk management. They will know what to do. Raising awareness of risks to information in healthcare is taking place all week long, but healthcare risk management itself takes place every day of every week of every month all year long. Please do your part in keeping our patients' and residents' information safe by raising a red flag of concern if you see something wrong. If it feels wrong, there's a good chance there is something wrong, but don't take the risk of saying nothing. Contact your local risk management department immediately. Information protection is everyone's responsibility, and Secours employees are the front line in our defense of our patients' and residents' information. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Secours Productions and is solely responsible for its content.